Hi, my name is Mary Beth, and I will be the narrator for Care of the Patient with a Tracheostomy, Part 1. Nurse Mary receives report from the 8th floor nurse on a tracheostomy patient being transferred to a higher level of care due to increasing pulmonary secretions and a risk of hypoxia. Mary can hear the anxiety in the 8th floor nurse's voice. She quickly grabs suction for the room so she's ready, and then runs to find the charge nurse, lets her know she's leaving the unit to get the patient, and off she runs. When Mary arrives to the 8th floor, the patient seems stable at this time, so she helps move the patient onto the stretcher and heads back to her unit with the patient. When they arrive in the ICU, Mary realizes the patient's vital signs are beginning to become unstable, so she calls for help and then realizes that she needed more supplies in her room for this patient with a tracheostomy. Mary then begins shouting for staff to help determine which tracheostomy supplies she needs. Her coworkers were forced to run out of their rooms to help grab supplies before this patient deteriorated even further. Nurse Mary and her nurse colleagues were able to stabilize this patient, but not in the smoothest fashion. Mary was extremely stressed and embarrassed as she realizes that this could have been avoided if she knew which trach supply she would need. This education session will review tracheal anatomy, the tracheostomy procedure, and the necessary supplies to properly care for this patient population so nobody gets stuck in Nurse Mary's situation. First, we will begin with a quick anatomy review. In this picture, we can see the tracheotomy procedure. Remember, tracheotomy is the procedure and tracheostomy is the opening created by the incision. In a tracheotomy procedure, an incision is made below the cricoid cartilage between the second and fourth tracheal rings. This procedure is performed when a patient requires prolonged intubation, since oral intubation is not long-term. The other reason to undergo a tracheotomy procedure includes bypassing an upper airway obstruction, typically related to cancer. A tracheostomy tube is placed to stabilize this newly created airway. Since there are so many styles of trachs, we will do a review. The following trachs are what we use at our facility. This first trach is an adult Shiley cuffed. Comes in sizes 6 French and 8 French. The basic parts of this tracheostomy tube are the cuff that is inflated during mechanical ventilation, which is also there to prevent aspiration. The cuff is inflated with air to maintain a seal around the tube. This allows airway exchange to only occur through this tube, meaning no air exchange between the nose and the mouth. Use of this Shiley does not allow the patient to talk. Other parts of this tracheostomy tube include the outer cannula, which is the trach tube itself, all the way to the left in the picture, the inner cannula, which is the one in the middle, and the obturator on the right. The inner cannula allows for smooth suctioning. It is disposable in this example and locks into place. The obturator is used for the tracheostomy insertion. This image is an extra long Shiley, which is similar to the regular Shiley, but just longer for patients with thicker necks. There is a disposable inner cannula. The main difference is how the inner cannula locks into place. This next image is a fenestrated cuffed Shiley. The same setup as the regular Shiley, but the big difference is the opening in the posterior wall of the outer cannula, which allows air to flow to the larynx, which allows the patient to speak when the cuff is deflated. This inner cannula must be removed for speech and is also reusable, so the inner cannula must be cleaned with that special tracheostomy. The last type of Shiley discussed is the fenestrated uncuffed. So this style is for a patient that does not require mechanical ventilation and is able to speak. This is typically placed for a long-term and permanent tracheostomy patient. The inner cannula is disposable, and the little red cap seen in this image is used for patients stable enough to talk and can breathe through the nose and the mouth. This tracheostomy in the picture is an old-fashioned metal trach, not commonly seen anymore. There is no cuff and no fenestration. The inner cannula is not disposable, so it must be cleaned with that special tracheostomy. This tracheostomy tube is called a Bavona trach, which is mostly seen in the pediatric population. This style is known for its comfort, and that's because it has the ability to flex to the patient's trachea. The most important thing to remember with the Bavona trach is to call respiratory if and when a patient is admitted with this style of trach. Now that we have covered why a patient undergoes a tracheotomy procedure, as well as a review of the trach tubes, we will now review what to keep in the patient's room when caring for these patients. First and most important is gloves. Always remember to wash your hands before doing any type of trachea care. Tracheal suctioning is considered a sterile procedure, while tracheal care is a clean procedure. Suction kits as well as the tracheal cleaning kits come with sterile gloves. Second most important item to have in a patient's room is suction. This is a wall suction picture, which is necessary to clear a patient's airway whether you're suctioning the oral or tracheal airway. The other part of the suction required is tracheal suction kit, which comes in different sizes and is best to keep about 5 kits at the bedside. Typically 10 French and 8 French are sufficient, but this always depends on what size of the trach the patient has. Another extremely important item to have for any patient that requires oxygen is humidification. Adding moisture to oxygen helps to prevent the patient's airway of becoming too dry, which always leads to mucus plugs and can block an airway. This is considered a tracheal emergency. This might seem obvious, but ambu bags are obviously extremely important to have at every patient's bedside. It is good to remember how to disconnect the face mask from the ambu bag and connect it directly to the trach. Lastly, equipment necessary for cleaning a trach is always good to have at the bedside. Patients with disposable inner cannulas obviously need a box of inner cannulas at the bedside. Non-disposable inner cannulas require the cleaning kit. For all trach patients, normal saline and hydrogen peroxide are necessary for the cleaning process, as well as gauze, cotton tip applicators, and clean trach ties. It is also extremely important to have an extra trach at the bedside. So now that we have reviewed the basics for caring for this patient population, it is of utmost importance to always be prepared in caring for every patient and avoid the trouble that Nurse Mary encountered.